recent years, the concept of gluten sensitivity and gluten-free diets have certainly gained significant attention and awareness. Celiac disease, in particular, is being diagnosed more frequently, mostly due to increased awareness and improved screening methods. So today, we'll be talking about celiac disease, how to recognize it, and most importantly, what to do about it. If you have celiac disease or know somebody that does, by all means like this video and comment below so you can be part of the conversation. So what is celiac disease? Celiac disease is an inherited autoimmune condition in which the body produces a reaction in response to exposure to gluten-containing foods or products. When an individual has celiac disease, their immune system reacts to the presence of gluten, which is basically a protein that is found in certain grains, and this reaction actually causes damage to cells of the small intestines, and then subsequently you get malabsorption. So as with many autoimmune conditions, the onset of celiac disease may be triggered by a number of events, including stress or physical trauma. Now, it's important to distinguish between celiac disease and gluten intolerance. This is also known as non-celiac gluten sensitivity. While individuals with non-celiac gluten sensitivity experience symptoms very similar to those with celiac disease, it's not as well defined, and it's basically diagnosed by actually ruling out celiac disease, wheat allergies, and then other possible causes. In both cases, individuals demonstrate improvement, though, in all the symptoms by adhering to a gluten-free diet. So symptoms of celiac disease can vary between individuals, which makes it very difficult to diagnose. Weight loss and GI symptoms such as abdominal pain, gas, diarrhea are very common, and other symptoms include fatigue, mouth ulcers, dermatitis herpetiformis, which is a skin condition characterized by an itchy rash with bumps and perhaps blisters. Celiac disease can lead to damage in the intestinal lining and then therefore malabsorption of nutrients. And when this happens, it can increase the risk of health conditions associated with malnourishment, like osteoporosis and arthritis, infertility, anemia, stunted growth, type 1 diabetes, ataxia, depression, neuropathies, and thyroiditis. So, what can you do? First of all, avoid gluten-containing foods. To date, the only treatment for celiac disease is strict adherence to a gluten-free diet. So individuals with this disease should avoid gluten-containing foods and should also be very cautious of foods that may have been exposed to cross-contamination in the manufacturing process, for example. The following grains contain gluten and should be strictly avoided: wheat and varieties of wheat, including spelt, kamut, farro, durum, bulgur, and semolina; barley, rye, and triticale as well. Now, gluten-free grains and pseudo-cereals that are generally safe to consume include corn, millet, rice, sorghum, amaranth, buckwheat, and quinoa. While oats are gluten-free, they are especially susceptible to cross-contamination as they're often processed in a facility that produces gluten-containing products. So when purchasing oats, look for gluten-free oats only. And when shopping, gluten-free certifications can help you make better and safe choices. Gluten-free certifications indicate that a product has been extensively tested by a third party to ensure gluten content does not exceed a safe amount. It's also important to be cautious and read the ingredients of gluten-free products, as many have unhealthy additives to improve texture, color, and flavor. Number 2, correct these nutrient deficiencies. Nutrient malabsorption related to celiac disease may lead to deficiencies in several nutrients such as vitamin D, all of the B vitamins, calcium, and iron. While supplementing with a multivitamin can help prevent and address general nutrient deficiencies, there might be deeper issues that may need to be sorted out. And as with foods, it's essential that you ensure that the supplements you're taking are also gluten-free. Now, we know that celiac disease can contribute to the damage of the intestinal lining, so supplementing with things like glutamine, curcumin, or zinc carnosine can help heal the gut, improve digestion and absorption, and decrease the risk for further complications. Number 3, get tested. While celiac disease is often discovered when an individual's symptoms are resolved simply by following a gluten-free diet, Diagnosis of celiac disease may also involve a blood test and/or a small bowel biopsy. Early diagnosis and treatment with a gluten-free diet can help prevent excessive tissue damage and reduce the risk of related complications. If in doubt, why not rule it out? When it comes to celiac disease, now you know how wellness works.